If you're interested in all of what we're doing, you're going to look to find out more about the world of neurofeedback. And you're going to find that, for instance, on YouTube, there are like 460,000 videos on brainwave biofeedback or neurofeedback, different technologies. There's a lot out there. And I have seen in the last 30 years this field just grow, just explode. There are neurofeedback systems using infrared sensors like the Mendy in the $350 range. There are all kinds of other kinds of neurofeedback systems that are bands and have software that can work on your iPhone, and they are fun. They are fun in the $300 range, sometimes $500 range. And they're great for use at home. If you want to meditate better and you want to replace that morning cup of coffee with being more focused, have a little bit more self-regulation, these kinds of things are great. But when we're talking about a clinical setting where you are a licensed professional, you're a psychologist, a medical doctor, you're a chiropractor, you're a licensed marriage and family therapist or LCSW, but you are working with people with health or mental health concerns in a practice, this direct neurofeedback is exactly what you want to look for, and let me tell you why. When it comes to professional quality equipment, you're going to have a couple of different elements in this. You're going to have how long does it take for my patient, my client, to notice there's a change and to start to respond and get optimistic about the treatment. How much of an investment do they have to make first before they start to notice a change? And then, secondly, how much training does it take for me or for my technician to learn how to operate this well so that my client gets benefit out of it? Those are the two most important elements when it comes to a clinical practice, not what does it cost. Because you could save money over on this side, but when it comes to training or clients coming, which was a marketing effort to get them to come, you told them this was going to work and they come and they're there for 10 sessions and they feel nothing, then they don't come back. That's a loss. So what we want as clinicians is we want a technology that people right up front know that this is helping them. That 90% of the people who come and try direct neurofeedback notice something significant, notice something positive after the first session. And so they come back. And also a technology that is simple to train, relatively simple. I mean, it's still a medical device, but relatively simple to train, for you to be trained with it and for you to train a technician, a nurse, biofeedback technician. Simple to operate, fast results. This is the combination that we're looking for in a clinical practice. And that it works, that it actually helps your patients. Direct neurofeedback is that technology you're looking for. Now, I have done a lot of traditional neurofeedback through the years, and we still use it today in our practice. Our athletes are all trained with traditional neurofeedback as well as direct neurofeedback. But when I was in solo private practice as a clinician, all I used was direct neurofeedback because my clients felt the impact immediately. 9 out of 10 of them knew at the end of the first session that something significant was happening, something positive was happening. And we got results very quickly. In traditional neurofeedback, the course is typically something like this. There may be a brain map with computer printout that the client has to invest in. And then based on that and that report, then the client begins treatment and may take 5 or 10, 15 sessions before they kind of get what they're doing, because it is operant learning. You have to learn how to do it. Now, some systems are better than others, And the system we use with athletes typically only takes a couple of hours for the athlete to sort of get what it is they're doing and how to do it. It's an excellent system, but it's very complicated. But the typical traditional neurofeedback that's sold to mental health professionals or chiropractors or medical doctors, you're looking at having to convince your patient that they're going to be there about 10 or 12 or 15 hours before they really start to notice a difference in treatment. And then it might take 30 or 40 hours of treatment before they reach their treatment goals. This is how it is. When it comes to direct neurofeedback, again, the person 9 out of 10 times notices something is changing in their brain the first session, and they'll report clarity of thought, relaxation in their neck and shoulders, warmth in their hands, a shift in the parasympathetic nervous system, perhaps better vision, these kinds of changes, less anxiety, peace, calm, focus. It's really nice to see. Some people notice it when they're in the chair. Some people notice it 2 or 3 hours later. But 9 out of 10 people will report that that first session convinced them they wanted a second. And depending upon the diagnosis, the issue that you're treating, some people reach their treatment goals within 12 or 15 sessions. Other people, it takes a little bit longer. Somebody who's gone through the windshield of a car and had pretty traumatic brain injury, it's going to take a little bit longer than somebody with an anxiety disorder. But I've never seen anything as good as the direct neurofeedback technology. The CalmWaves direct neurofeedback, I think, is the very best thing that you can put into your clinical practice.